don't be fooled. You know, a lot of people want this to be the greatest country in the world, but until some of these things are corrected, this is not the greatest country in the world. Because I did my research on medical camps for kids, and a lot of countries sponsor free medical camp for all comers. But here in the United States, I did not find a free medical camp. If you don't know who I am, I'm David Rogers, and this is Rogers Media Mindset. And today we're discussing the disparity in the medical field. There are only 5% of licensed physicians in this country are either black or Hispanic. So here we have so our remedy to this situation is medical camps for kids. What's going on? Medical camps for kids. That is the solution to the problem of enrollment into medical school, qualifying for the MCAT, a mandatory barrier to entry into medical school. You must have recommendations. You must have internship. You must have proof that you have been exposed. You must prove that you have been exposed to the uh, medical environment. So we need to get our young kids involved in medical camp as soon as possible because hip hop is not waiting. A lot of these societal norms that happen here in the United States are not waiting for you, waiting for our kids. They're getting at them even earlier than the age of the children that you see before you right here participating in a medical camp. I do have some resources for you to look into towards the end of this video that discuss the medical camps and how you can get involved, how you as parents can get involved. Here are a number of medical specialties that you might interest your child in, because it's not just about black doctor. You just be a doctor. You need to try to direct your kids into a certain field of medicine that they may have a more of an interest in. One being anesthesiology, comforting, which is the art of which is directly comforting those going for surgeries, and anesthesiology is a real profession, a real medical profession. Cardiology, keeping the heart and lungs and the inner workings of the chest area in order. Cardiology is huge. Dermatology, the skin. How many of us, this beautiful black skin we have, we keep it, we use all kind of stuff, Nivea, whatever. But dermatology is a medical profession that is not to be overlooked. That is a excellent for an excellent entry level gateway, um, a gateway subject to get our kids involved in medicine and to become doctors. So then, let's just keep going down the line. We've got emergency medicine, family medicine, forensic pathology, general surgery, and hospital medicine. Um, these two women right here are mother and daughter, and they both graduated at the same time in the same ceremony, one in family medicine and the other, Dr. Kunji, in general surgery. And that was in 2020. I held on to this photo for so long because I did have a website complete, and I let it lapse, and they took it off the server. So, thank God for technology and that I'm still here. I'm still able to promote this message of diversity in medicine that we need so desperately. So, medical camps is a solution that I have identified as you know I need to get medical students that are actually in the trenches, that have taken the MCAT and are in their second or third year of medical school, to leave comments below and give advice on the way forward, because this is a humanitarian crisis. Only 5% of licensed physicians in this country are African American, black. Okay. So that means that when COVID hit, all of those pre existing conditions were exasperated and were exploited, and a lot of us passed away during the COVID-19 pandemic because of these pre existing conditions. Because you, as a black person, you're not going to have the same care that you would have from someone that understands your cultural similarities. And so the care is different. Even though, and I have interviews showing where black people have said that, hey, the doctor, their white doctor, or just say non-black doctor, was did a sufficient job, but it wasn't the same level of care that it would have been had it been a African American or black doctor, black patient, black doctor relationship. You cannot substitute that. It's like you cannot substitute that. Okay. Similac is not going to substitute breast milk. Okay. So, I'm running through this quickly, but let's take a look at the medical. These are the medical summer camps and look, this is just a short list. Now, your own community, your own neighborhood, your own universities and clinics offer things in where you are. So it's do your own due diligence as far as finding a day camp, a 2 day session, or even would be wonderful to immerse a child into a 3 week or 4 week session where they're learning a lot. They're getting repetition in the medical field and getting exposed to the medicine. What we have here is a little medical school in Phoenix. I've come to know that this is a franchise, so there is one in California. So it might be a West Coast thing, but there's a link right there that I'll leave the link below in the description as well for you to reach out. So again, there's lots of programs. You need to kind of seek and find them in your local area. So here's a St. Louis University. They also have a summer scholarship for young people. Tallahassee Memorial Healthcare is offering volunteer summer camps for teens. That is going to be a game changer in Florida. And Indianapolis kids out and about. Okay, so the Midwest is being represented as well, as far as my research was concerned, and I try to just make it as regional as possible. There are lots of camps and opportunities to expose kids to medicine in your area. So, last but on this, as far as this list is concerned, Children's Healthcare of Atlanta. So, there's tons of hospitals in and around Atlanta and Georgia. So call around, see if you're not in this location, call around and see what's up. But this is what has to happen. This is the remedy. This is the solution. Exposure to medical activities, exposure to the medical environment early on, early on, because like I told you before, hip hop and all these other uh groups that's jumping out of here right now talking about they want rights too, and they need this and they need that. So we need to buckle down, get our kids in pointed in a direction that is going to be useful. Forget all these hobbies and all this other stuff that's going on, because we are not being represented in the hospital. We are not being represented in medical school. It is a humanitarian issue. Your health is wealth. It's all we have. So let me show you what it looks like. Let me show you what it looks like. This is the New York University student body. Half of these youngsters are in med school. So we need to show pictures of Black excellence. And that's what this is about. These brothers right here are at University of Cincinnati, and they are all freshmen. These 10 Black men in University of Cincinnati College of Medicine's first year class at their white coat ceremony. So we need Black men in white coats. That's what it looks like. See, I want the parents to have a vision for your children, and this is the vision. This is the fruition of the vision. These men have passed the MCAT. These youngsters have passed the MCAT, and they are in medical school and and in the process of becoming Black young doctors. And there's not enough of this going on. It's far too few photos like this. We need more photos like this. A Black patient is far more comfortable and willing to express what it is going on with them, what they're feeling, if they feel like they're being understood. That's in general, that's in life, right? You if you feel like you're being listened to and you being understood, you're going to be far more open and honest about what's going on in your body. And because this is not taking place often enough, the pandemic really had an adverse effect on the Black community. So what we need to do is get more Black doctors um, into the types of situations that we need to get more Black kids into medical school, get them internships where they can be recommended, where a licensed physician would recommend them, because in order to when you take the MCAT, in order to one of the requirements is to have an internship, having done an internship, whether administrative or in the office with the doctor. The discovery of the fact that, hey, life, let's give our kids life, and that's what this is about. So that's what this is about. Hey, my name is David. I'm with Rogers Media Mindset, and this is a medical talk. And I just try to provide a resource for the parents out there that are interested in seeing their kids uh, have an opportunity to become a doctor. It's a dire situation. It's a dire situation. It's already been ruled a humanitarian crisis. So it's not even about what somebody else is saying. It's about the fact is that we need representation in the hospital, not just as patients, not just as patients. So, hey, like and subscribe. If you like this video, subscribe.